Hi everyone, why the spine matters in male pelvic pain. That's the topic for today's discussion in our men's health series. I am Giri Srinivasan, registered physical therapist and pelvic floor physical therapist with special interest in male pelvic floor pain. Most of the patients I see, back pain and pelvic pain, they coexist. Lower back pain is the independent predictor for the pelvic pain in a male population. Pelvic floor dysfunction such as non-relaxing pelvic floor muscles is one of the main problem we see due to the spinal issues in men. Who are these men? Most of these men sit for a long time for the work, whether they are long haul truck drivers or a software engineer or a desktop guy who sits about 10 to 12 hours, even 8 hours a day and not moving very well. These are the main category we see in this kind of male pelvic pain area. Various lumbar spine conditions, which is your lower back conditions, have a negative impact on your urinary, sexual and defecation functions in your body. There are three ways your spinal problems can affect your pelvic floor functions and also male pelvic pain. Number one reason is referred pain from the spine into the pelvic area. It can be anywhere. We can map that pelvis. So we have this pelvic mapping right here. You can see this is the female pelvic mapping and this is a male pelvic mapping here. We'll give it to the patient for you to mark which areas you have pain, and that gives us a good idea for us, it could be a possible spinal origin or not. Second reason or second theory is some of the spinal conditions, especially in the lower back, directly affect the nerves which supplies your urinary tract and pelvic organs and pelvic functions. When that happens, you will have some trouble as well in your pelvic area. The third reason is sometimes you can have peripheral sensitization or central sensitization. That's nothing but the nerves cross-talking to each other in your spinal cord or cross-talking in the brain, where even a smaller, very gentle stimulus can be seen as a bigger stimulus from your brain or the sensitized nervous system, and you can experience increased pain, diffuse pain in different areas because of that process. So these are the three main reasons how your spinal problems can cause pelvic pain. How these people present to you, right? And in the clinic, what do we see as a clinical feature? Number one, they have wide variety of presentation. The pain is very diffuse. They can have a little bit of pain in the pubic area, sometimes on the base of the shaft of the penis. A lot of people have pain in the tip of the penis. This is one of the most common area. And in the testis, sometimes it's unilateral, sometimes it's bilateral, and then going down into the perineum area. And some people have pain here also. Some people also can have pain around the anus as well. But the most common area, the male complaints pain, is the tip of the penis and the pubic area. Then comes your perineum. So this is kind of that anatomical reference for the pain referrer in male pelvic pain. There could be a lot of different presentations for these patients. Number two clinical feature is there will be rapid changes in the intensity of the pain and in the location. One day it can be in your perineum, the next day it can be in your testis. And one day you can have 2 out of 10 pain, next day you can have 5 out of 10 pain. So that's another clinical feature we commonly see if that pelvic pain, your pelvic pain, is of spinal origin. And the third common thing we see during our objective assessment with our pelvic floor patients is it follows a directional preference. Sometimes we can alter your pelvic pain by extending your spine or flexing your spine or rotating your spine or lateral flexing your spine. You might have some directional preference which can alter your pelvic pain. The important game changer for us as a physiotherapist is the repeated spinal movement. When we do the examination like that, that can alter your pelvic pain right away. Depends on which directional preference you have. So that can improve drastically. Your pain can improve drastically in just the first session itself if your spinal origin pain is of directional preference. So the biggest game changer is a repeated spinal movement once we identify that cause. So to summarize, your spine, especially the lower back spine, can be the master switch for a lot of your pain in your pelvic area. So if you're a male suffering from any pelvic pain, and if you're sitting for a long time or are experiencing any pain in the pelvic area, don't think you need an internal examination or a lot of pelvic floor address. It can be just worked out by treating your spine without even touching in your pelvic area at all. Almost 50 to 60% of the male pelvic pain I see is of spinal origin. And a lot of people don't know that. They always think there's something wrong with your private part or your perineum or pubic area or your anus or something like that. Okay, so you can easily work on this with the right advice with your pelvic floor physiotherapist. So if you have any questions, please give us a shout at Instep Physical Therapy and we will take care of you. Bye.